And we're about to hit the family gathering season, and with that, multiple types of viruses may await your cells. Do you have, or your kid have the cold, the flu, COVID? Can adults get RSV? We try to answer those questions. Chief of Family Medicine at Hamilton Health Sciences, Dr. Tamar Packer, says while COVID and RSV get all the headlines, the main culprit this holiday season is still the common cold.
The most common viruses are a group of viruses that cause the common cold, and that always has been and continues to be the most common thing that happens.
The cold tends to be the most mild of all the seasonal viruses, including a runny nose, sneezing, coughing, a low-grade fever, but not enough to be bedridden. Dr. Packer says the flu and COVID share many symptoms, including its quick onset, overheating, chills, headaches, muscle aches, and body pain, runny nose, sneezing, coughing, and fatigue. COVID stands out with the chance that some may lose their sense of smell or taste. Packer says adults don't get serious reactions to RSV. Children under 2 years old, however, are at a higher risk.
If you think about a little kid, their airways are little. So if you're dumping a lot of mucus and inflammatory cells into the airway, it's pretty easy to narrow the pipe to a point that the child has difficulty breathing, which is why kids with RSV who are sick have this very wheezy cough.
The flu gives kids a different kind of cough.
Those kids typically have a dry cough, and their respiratory symptoms may or may not be as severe. But with flu, what we see is the degree of fatigue with kids can be pretty significant.
But Dr. Packer says a parent shouldn't try to self-diagnose what their kids actually have.
I think in terms of determining what they have, that's probably a higher ask than are they sick or are they okay? And that's, I think, the role of the parent. And then it's bringing us in to help determine what they have and if they have something significant.
Instead, Packer suggests treating the symptoms as they come with hydration and fever meds, if available, and to contact the doctor if
that fever is not coming down. It doesn't have to come back down to normal, but if it doesn't reduce a degree or two when you're giving them appropriate dosages of fever medication, that's a sign for concern. Or persistence of fever for 5 days or more. Those are certainly reasons that would necessitate you bringing your child to get an assessment.
And Dr. Packer reminds us that heading into the holiday gathering season, to get your flu shot, stay home when you're sick, and if you can wear a mask as well if you're inside with a vulnerable person.